In general, when we see a recurrence of breast cancer, it is most likely within the first 5 years and almost always within the first 10 years. There are, however, rare, very late recurrences many years after the original diagnosis. The latest I've seen is 36 years after a mastectomy, where a woman had a typical local recurrence in the skin of her mastectomy site. So that while late recurrences are very rare, one always has some minuscule risk of recurrence even many years after the original treatment. The term disease-free interval is defined as the interval between the original treatment and the recurrence. In a sense, with a very long disease-free interval, the implication is that that tumor is a very slow-growing tumor. Late recurrences tend to be in skin or bone, which are the better prognostic sites, and tend to be hormone receptor positive, and actually tend to respond quite well to anti-estrogen types of therapy. So that one, in the case of bone metastasis, would begin some hormone therapy, such as an aromatase inhibitor, and would add some anti-bone or some bone healing agent, such as Iridia or Zometa or the newer drug Xgeva. And in general, we would continue those for as long as they worked. We don't have any data to indicate that switching therapy during a remission would be helpful. So the ideal would be to have a patient on Iridia or one of the other bone agents with an anti-estrogen agent that works for many, many years. But as with stage 4 breast cancer in general, at some point, that disease will either progress in the prior site of recurrence or develop other sites of recurrence, which will mean a change in therapy to ultimately more hormone therapy that one hopes continues to work, or ultimately chemotherapy.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment.
and the genomic test.
A test that helps guide a woman and her doctor
To the best treatment options for her.
Pass it on.